Most of us are aware of the controversy surrounding the recent signing of the Patient Protection and Affordable Care Act. What you may not know is this law includes the Women's Health Office Act, marking a tremendous moment for all women who, as a gender, have been mostly excluded from clinical research until as recently as 1993. While the U.S. healthcare system as a whole has been slow to consider sex-based biology in research studies, many physicians have dedicated their lives to providing their female patients with the most focused gender-based care available. Ask the Specialist traveled to Laguna Beach, California, where Dr. Red Alinsod, a top urogynecologist and pioneer of female health issues, educates women, their partners, and physicians from around the globe.
I think more dollars should be spent on women's health care issues. My special field, pelvic reconstructive surgery and aesthetic gynecology, you know what? The people who want these services are baby boomer generations. I'm hoping that the focus in women's health will increase.
Considered a breakthrough in female health care, urogynecology is a combined specialty that encompasses urology, obstetrics, and gynecology. This specialty treats the entire pelvic floor, and in the case of Dr. Alinsod, the importance of aesthetics when repairing damage in this area. Understanding who Dr. Alinsod is and the special training he received gives us a better idea of how his dedication has impacted women.
I went to Loma Linda University School of Medicine, and I love that place because it had a mission-oriented medical school. It was kind of along the idea that I liked because my grandfather was one of the original missionaries in the Philippines. So I grew up following around my grandpa in the jungles. After my medical school years, I went to an OBGYN residency, and then I got into a gynecologic oncology fellowship at Yale to start in 1990. I really wanted to be a pelvic surgeon. Unfortunately, there was that little war called the Gulf War. So I became the gynecologist that took care of a lot of the Air Force Thunderbird wives. Nellis was the home of the Thunderbirds, the unit that did all the acrobatics. You know, the Navy has the Blue Angels, the Air Force has the Thunderbirds, elite team. And I got to take care of many of the wives. I kind of got called by some of the pilots and wives there as the gynecologist for the Thunderbirds, which sounded weird because, you know, Thunderbirds are all men. After my Air Force days were over, I was able to go to lots of different great places to train. This was when endometrial ablation was just starting. I decided I'd stick with urogynecology pelvic reconstruction because I loved it.
As a female spending time with Dr. Alinsod and his staff at South Coast Urogynecology, one gets a sense of their commitment to provide the most comprehensive care to their patients. One phone call or visit to their information-packed website, urogyne.org, can provide in-depth explanations about many sensitive subjects.
Most people call the office because they have been searching for someone to help them with their problem that they've had for many, many years, and they didn't realize that there was a person out there that did this type of procedure and that cares so much for his patients.
How did you find me?
On the internet. Your website was really educational for me.
Well, even in Redding or Northern California, there are very few that combine the pelvic reconstruction with the aesthetics. And so you had told me earlier you like that combination.
Yes.
Where you can take care of both problems, the way things function and the way things look.
Yes.
A lot of females, they get so embarrassed to ask about this kind of thing. And I started telling my friends, and they're like, that doesn't exist. I said, yes, it does. It's so good now. The quality of life, quality with my partner.
Well, Dr. Alinsod is a great surgeon, a great physician. He does the pelvic reconstruction, the urogynecology, specializes in the vaginoplasty. Probably 2-3 years ago, I would never have known about vaginal rejuvenation. So this was very, very new to me. What I've heard in the time that I've been working here is many women are kind of shocked about the possibilities for the women's issues today. especially the feeling that they have after traumatic childbirth. Your body changes after several years, and many women don't realize that there are things that can be done to help you feel better about yourself, to help you feel 21 again is one of our slogans, actually.
Combining a top pelvic reconstruction surgical facility with an office philosophy based on the business practices of a five-star hotel, patients are provided with treatment options that are second to none.
My entire staff know that today's job has to be done today. There are no excuses. Today's labs have to be reviewed today. The patient has to be reviewed today. If something comes in today, no one goes home until that work is done today.
I love how well I've been treated. I think I'm in the right hands.
Well, thank you. That's great.
Dr. Alinsod's outstanding commitment to his practice includes the weekly training of urologists, gynecologists, and plastic surgeons in the procedures he has helped advance. Not only with his surgical skills, but also as the inventor of many of the specialized instruments that were created to perform these delicate operations.
This is the Lone Star retractor. It's called the Lone Star APS. This part here actually works as a Velcro back. I have at least anywhere from 1 to 3 doctors come here every week that I take to the hospital and spend the whole day with them doing surgery, doing didactics, PowerPoints, hands-on teaching. I teach them electrocautery techniques. It's a fun day. Just about every Monday is with surgeons, usually gynecologists, urogynecologists, or urologists, who come from all over the country, everywhere.
For more information on female pelvic medicine, including surgery footage, a link to Urogyne.org, and bonus interviews with Dr. Red Alinsod, please visit AskTheSpecialist.tv.